We teach something called the maximum case acceptance system, which literally is a step-by-step process that connects your marketing to the case acceptance process and the practice, all the way from the point where the patient calls the practice to the point that you've done your case presentation to even after the case presentation. Now, classically, what you hear in the profession is everyone kind of runs around talking about case presentation as if that's all, if that's the one magic thing that creates cases. And the problem is that there's so much in the area, so much science being ignored in influence and persuasion when we just deal with case presentation that we're losing all of these behavioral tools that really create the reasons why patients decide to do treatment. So if you just concentrate on case presentation, you're not going to win. But yet, if we develop a system that goes well beyond that, from before the patient ever gets in the chair to after the presentation, we've got a much better shot at patients doing very, very good things for them. So therefore, we put that into an actual system. And we call it maximum case acceptance system because we've yet to see anyone else out there beat those kind of numbers. And it's worth repeating that when we're teaching a sales system, systematic selling, the maximum case acceptance system, that we're really, again, it's not just case presentation. Because again, that's something you talk about in dental school, and usually you learn something very ineffective there. You go out to your clinical courses and they teach you, quote, case presentation, and there are even people who focus on case presentation. None of that's bad, because everyone needs at least a base level of communicating, but it's missing so many other components. So we can't just say, let's train everyone in great case presentation, because there's far more to it. And we're really actually being unfair to the patients if we leave out all of the psychology and behavioral tools that we know apply to the situation. Well, and the thing is with the maximum case acceptance system is that it does allow you to have conversations even with insurance patients. So you have practices, and again, we're not here to advocate saying dentists dump their insurance, because that's not always a wise decision, because you suddenly will have no business underneath you. You have to have somebody to support the business. But one of the beauties of being able to systematically sell is now you can continue to offer your insurance patients choices. And hard as it is to believe, there are patients sitting in there who are insured who want to make a good choice that you aren't offering them. It's the same thing as when you get on an airplane and the seats are all being sold at prices all over the place. Same thing's happening in your practice if you're not giving the patient a choice to pick which seat they want to sit in. But by using a system like this, you have that ability. The nice thing about case acceptance is that if you review even just the first DVD, if you're doing the DVD program, there are literally things on that DVD that the very next day in your practice you can make changes that you'll see a benefit from. So you can go from basically 0 to 60 in a split second. When you're doing marketing, it's a lag time between running an ad and now seeing some results. But with case acceptance, we can give you a result much faster. Beyond that, for the doctors who do implement quickly and have their staff help them implement quickly, they can be doing major cases from the marketing they're already doing in a matter of weeks as well. We see that all the time. Doctors show up in the room saying, I'm here for my live training now, and I've already been working on things at home, and I'm amazed at how fast I've gotten the results, even though I'm not really even halfway finished yet.